In vitro fertilization, introduction, assisted reproductive technology, that is ART, which includes medical procedures in the manipulation of reproduction in humans and animals. It is primarily used in infertility treatments, hence it's also called fertility treatment or ART. It includes the following techniques. First one is IVF, in vitro fertilization, ZIFT, that is zygote intrafallopian transfer, then gamete intrafallopian transfer. Third one is intrauterine insemination and intracytoplasmic sperm injection. These are all some techniques which comes under assisted reproductive technology, that is ART. What is IVF? IVF broadly deals with the removal of eggs from a female, fertilizing them in the laboratory, and then transferring the fertilized eggs or zygotes into the uterus a few days later. This is in contrast with the natural fertilization process which occurs in the uterus. Through IVF technology, a large number of offsprings can be produced from a single individual. Why IVF? Infertility. Definition of infertility: inability to achieve pregnancy. Female infertility caused due to problems in the fallopian tubes, failed ovulation, induction, endometriosis, etc. Endometriosis means there will be a lining around the uterus. It is a tissue lining. In this case, in endometriosis, that lining of tissues will be present near ovaries or fallopian tubes. Male infertility caused due to idiopathic infertility, that is the low semen quality. About 17 to 26% of couples worldwide have this problem. 27 to 47% of infertile couples have impaired male fertility, decline in semen quality worldwide over last 50 years. Why there is an increase in infertility? Some of the reasons behind infertility, like delayed marriage and childbearing, sexually transmitted diseases, hormonal contraception. Some pills will be used as contraceptives. This will affect the natural hormone balance will be affected adversely by using these kind of pills. Then abortion, obesity, and environmental pollution. These are some of the reasons for increase in infertility rates. History of in vitro fertilization. It is a fertility procedure which was first succeeded in 1978 by Dr. Robert Edwards. He was a physician and also an embryologist, and Dr. Steptoe, he was a gynecologist from England. Since then, the technology has been further refined and developed by physicians and embryologists, with over 20,000 babies born worldwide till now. Louise Brown was the world's first child using in vitro fertilization. And coming to India, Subhash Mukhopadhyay was a physician from Kolkata. He created the world's second and India's first child using in vitro fertilization. Her name is Durga. And coming to the South India, first test tube baby, her name was Kamala Ratnam. Which cases may be considered for IVF means female infertility caused due to the problems in the fallopian tubes, failed ovulation induction, endometriosis, and low semen quality in males. Let us look to the general protocol of IVF. There are 5 steps in this process. First one is ovarian stimulation and monitoring. Second one, egg retrieval or oocyte retrieval. Third one is fertilization step. Fourth is the embryo culture. And the fifth one is embryo transfer. You can see in the picture, stimulation. Ovarian stimulation is done by using certain types of drugs related to the hormones. They are given in the form of injections. Then before the egg retrieval process, ovarian stimulation and monitoring is done through the ultrasound scanning and blood tests. Once the ovarian stimulation process is over, then egg retrieval is done by sedation. I'll explain it in detail. The next step, semen collection and examination, then insemination and fertilization, development of embryos, transfer of embryo and implantation, and finally to the pregnancy test. Let us know about each step in detail. Stage 1, that is ovarian stimulation and monitoring. It is used to produce multiple mature follicles rather than the single egg. Normally, in a menstruation cycle, single egg will be developed in each cycle. So, in ovarian stimulation process, multiple mature follicles will be produced to help the procedure. First, both the male and females made to undergo fitness tests and checkups. Then the injectable medicines or medications are provided to the female daily for an average of 10 to 12 days to stimulate the woman's ovaries to produce multiple eggs. Then the ovarian response to the medications to be monitored, right? So this ovarian response to the medications is monitored with the help of ultrasound scanning, blood tests, and then the medication dosing is adjusted accordingly. You can see in the picture the scanning ultrasound view of ovarian stimulation. Next step is egg retrieval or oocyte retrieval. Egg recovery is accomplished by a transvaginal procedure. Okay, when the eggs are mature and ready after the stimulation process, the woman undergoes an ultrasound guided egg retrieval procedure under light sedation, we say. Sedation means medication, to give medicines in order to reduce the discomfort of the procedure or reduce the pain during the procedure, or local anesthesia can also be used for this process. For egg retrieval process to carry out, they use local anesthesia also. The eggs are retrieved from the patient using a transvaginal technique called transvaginal oocyte retrieval, involving an ultrasound guided needle piercing the vaginal wall to reach the ovaries. In the diagram, you can clearly see the needle piercing the vaginal wall to reach the ovaries. Through this needle, follicles can be removed by suction force, and the follicular fluid is passed to an embryologist to identify the ova. Okay, follicles are removed by the suction. That follicular fluid is checked whether it contains a ova by embryologist. It takes usually between 20 to 40 minutes procedure. 10 to 30 eggs are retrieved. Next step is fertilization. In the meantime, semen is prepared for fertilization by removing inactive cells in the semen and seminal fluid in a process called sperm washing. Inactive cells in a seminal fluid are removed by the process called sperm washing. Then comes co-incubation. The sperm and the egg are incubated together in a culture media in order for the actual fertilization to take place. The duration of the incubation should be about 1 to 4 hours to have higher pregnancy rates. In the picture, you can see the eggs collected after ovulation directly from the follicles, and the sperms are collected and concentrated, that is removing the inactive cells. Then they are co-cultured together in a petri dish by using a specific media. In this step, they may follow another procedure called intracytoplasmic sperm injection. In order to have a higher fertility rate, they follow intracytoplasmic sperm injection technique. Whether the egg and the sperm fail to get fertilized in a co-incubation procedure, if we do intracytoplasmic sperm injection, there will be fertilization rate will be high. During the process of intracytoplasmic sperm injection, an embryologist isolates a sperm cell and draws it up into a microscopic needle and then injects it inside an egg using a high power microscope. Here, the sperm is directly injected to the cytoplasm of the egg by using microscopic needle and high microscopic power. In the picture, you can see the procedure. Then comes embryo culture. After fertilization step, the embryos are allowed to grow in special media or specific media that are suitable for the culture of your cells for 3 to 5 days until they have reached optimal growth. Main durations of embryo culture. The main durations of embryo culture are until cleavage stage, that is to day 2 to 4 after co-incubation, or we say blastocyst stage, that is day 5 or 6 after co-incubation. Embryo culture until the blastocyst stage, that is 5 to 6 days after co-incubation, confers a significant increase in live birth rate per embryo transfer. In the picture, you can see the growth of embryo in the culture. In the first one day after fertilization, after 2 days, 3 days, and after 5 days, we can see blastocyst. The last stage is embryo transfer. Laboratories have developed some grading methods to judge oocyte and embryo quality. Once they've checked up for the quality, some 1 to 3 embryos are selected from the embryo culture. 1 to 3 quality checked embryos are selected and are then transferred into the uterus 3 to 5 days after egg retrieval. Under ultrasound guidance, a thin, long, tube-like structure called catheter containing the embryos is passed through the cervix into the uterus where the embryos are placed. You can see the procedure in this picture clearly. They are using a catheter, a tubular instrument. 3 embryos are placed together in it and are transferred into the uterus. Embryo transfer is not as painful procedure as the egg retrieval, so it can be performed without sedation or anesthesia. Once the embryos are placed inside the uterus, they say 3 to 5 days of pelvic rest is recommended after this procedure, that is embryo transfer procedure. Then a pregnancy test is scheduled after 12 days to confirm the pregnancy. There is a technique called cryopreservation. When we are not doing the embryo transfer method after embryo culture, the cultured embryos can be preserved using cryopreservation technique. Here, preservation in frozen state is regarded as cryopreservation. Semen, fertilized eggs, and embryos can be cryopreserved. Human embryos have been successfully preserved in the presence of cryoprotectant like 1,2-propanadiol or dimethyl sulfoxide or glycerol. It was stored at minus 196 degrees centigrade under liquid nitrogen. At appropriate time, the embryos are thawed and are transferred to uterus. Some of the risk factors in vitro fertilization or implantation in the uterus does not always occur. I mean, the implantation in the uterus may not occur. Higher risk of twins or triplets, that is multiple pregnancy. Increased risk of abortion, which also increases the risk of complications, then side effects associated with the fertility medications. The medications which are been given at the time of stimulation, they may have some side effects. Then higher risk of ectopic pregnancy, that is pregnancy may not occur inside the uterus. It may occur in fallopian tube or outside the uterus. It is a risk again, especially in women that have had previous problems with their oviducts will have this problem. Increased risk of abortion again. Then ovarian hyperstimulation syndrome. This is enlargement of ovaries with multiple cysts in association with it. Then low birth weight babies, premature deliveries, etc. Some advantages or fertilization is confirmed before the implantation can occur. It gives the women with damaged oviducts the opportunity to carry their own fetus. Limitation of IVF. Genetic defect in oocytes, a genetic defect in fertilizing sperm. These are the limitation. If the oocytes or sperm which are used in the process have the genetic defect, it will affect the process again. Then environmental mutagenesis. Mutation is the any genetical change in the genetic material. Then inadequate supply of nutrients and hormones, exposure to toxic agents and free radicals. These are all some limitation of IVF. She is the world's first test tube baby. Her name is Louise Brown. She is at the age of 42 now. Recent development in IVF. Women who are post-menopause can still become pregnant. Adriana held the record as the oldest woman to give birth using IVF and donated egg when she gave birth in 2004 at the age of 66. Thank you.